Nina's Parlor Online TV, influencing lives for better future.
Ebusiame Majo Elmakwaba Nina's Parlor TV SO and you made the health fair a bunny apomodin ho dia baby a obesia de papa e free Nina's Parlor TV SO na ohwe abo ene juada ye ba betwetwe nkomo e de afa ya pomodin ho esan se ya pomodin no e ho hia pa ye wa ma wa pomodin no hia wa empre ubewu anase ubefiri mana ya bi ebebo ema niema bebra wo ye no ebefiri wonsa Enunti my guest aba debia ye the nurses ekukudam ena eba an ena nso ye the nipa titru aba be ka yensa ye twa ye hombra ye ba ye beto aso Ebusiame da sibiom esanso mu akwaba so hwe the health fair e Nina's Parlor TV so waba ha onyiraye Mr.AHETO YouTube, Facebook, TikTok ana fe Instagram ni nyina Nina's Parlor TV enne ye topic a ye ba betwiti substance abuse obibaka say unim red ai tunim red a enne ye ba be kasa e de afa ho ene yellow green ana purple ni nyina ye ba be kasa e de afa ho me guest atna say yene no entwetwe enkomo pacha kwaba pacha Mr. Wisdom ana minim so bebo din na fi waka ho asem bakra e de atwe
your friend Wisdom Aheto.
Okay.
Dodo friend Efu.
Okay.
Near Edmo Obuasi Government Hospital.
Okay.
And near your department, psychiatric department, I want to be here tomorrow. So a whole you share a dream for your area.
Okay.
And you are doing for your area, your Juma will bring a year.
Okay.
So your Juma I take a cry. So I would say I've been for a very long time for some time.
Government hospital. Okay, so we send our regards to all Obuasi government hospital workers. And about the Kasafa substance abuse. So first of all, what is the substance first?
That was it. And say on my akonia we say you didn't come and far how your friend of substance abuse.
Yeah.
It's one of the things that we have to take seriously. You say be your first substance a bit me idea.
Yeah.
Idea obey me you see for some purpose.
Okay.
And in a substance. So you come on substance, it can be anything at all.
Yeah.
And either drugs or even water that we take is a substance.
Yeah.
You need liquid thing. They are all substances that we take into the body.
Okay. So today, since I health need to know, it will be based on drugs.
Exactly.
Okay. So let's talk about the abuse of it. Yeah.
Okay. So substance abuse. When we talk about substance abuse, is something that is very peculiar. It's very so prominent to our society nowadays.
Okay.
A lot of people have been abusing it. Something that we call substance abuse.
Yeah.
So substance abuse is something that is complex. It's a disorder of the brain, or it's a disorder of the individual.
Okay.
By abusing something that is so harmful to your health.
Yeah.
The thing is harmful to you. What you are taking, it can give you a detrimental health problem.
Okay.
But still, you want to take it for some desire that the individual feel of. So substance abuse, in a simple short, can be intake of any substances that cause damage to the individual, or take intake of substances despite its harmful effect on the body.
Okay. Okay. So taking any drug is not substance abuse.
No. For example, someone who take a paracetamol, it's not a substance abuse. It's not abusing it. But to the extent that the doctor have given you a dosage for you to take, say, Fadudo say, Fanu anopana nume. Fabaku. But when I can find there 2 or 4 at a day. Because of the people. So I need to say, what abuse it. Then the doctor trauma is a condo. So I need to say, what abuse it. That kind of substance. That is the drugs.
Okay.
So a hard drink a cry. So obi abuse that particular paracetamol. Then acquire what substance abuse or drug abuse.
Obi how to meet up instead say be obenum tu no obebubu ni nyina
yes, exactly.
No substance
abuse.
Okay, nti eno ne sa na ekọ body ni mu a what does it do?
So for example, when we take someone who abuses drugs, everybody need to take in something that will help him. But especially drugs, when you are sick, you go to the hospital. And medication is being prescribed for you to go and take.
Yeah.
It's being given to you with a maximum dosage that you can take for the body.
Yeah.
So a body will be your brain, your brain, a brain about me alcohol, but one pedria. Say maybe a painkiller, lady mau. So painkiller, I want the purpose. The purpose is say. A how every
pains
no every
okay.
So a pains now the it effect is for you to get out of the pains.
Yeah.
So after the pains you are relieved. So that medication have a maximum day that you have to take it. So after the maximum day, it's being taken out of the body, but the body system will take it out and it be excreted and the individual become okay and everything become normal. But when you abuse it, it go to the brain.
Okay.
It go to the brain. A whole problem now. Say, oko abuse drug, oko take drugs away. One thing that it does is it goes straight to the brain.
Okay.
So those who abuse those drugs, the brain have serious effect on the brain. Such as one, you have a chemical in the brain. For example, someone who abuses marijuana.
Okay.
This marijuana, when you take it into the body, get its effect straight to the brain. It activates some chemical in the brain that we call dopamine.
Okay, dopamine.
Yes.
Okay.
This dopamine is responsible for the pleasure that you pay. Say a pleasure now. What do you say? You did ya na mami. Accommodate me. You pay something that is okay. I can feel good. That is the dopamine. So marijuana, it will trigger it.
Okay.
That chemical will be released in large quantity. And the excitement never.
Okay.
Okay. So at the excitement never say nipa krono na akokane ho. Say ni de ni hu bia ni hu su ni nipa bia. Because of that kind of marijuana, I think that go and trigger that release of dopamine. Emma, are feeling happy, excited, overexcited. That can never be controlled by yourself unless you stop that kind of drugs.
I think this topic is a broad topic.
Exactly.
Which needs to be treated, I think, twice or 3 times. Okay. So what is the most commonly drug abuse?
Okay. That is a nice question that you're asking. This is about one thing that is always disturbing because you know mining community.
Yeah.
So obi pe edumadian. The most commonly used is marijuana.
Okay.
That is weed. The street name is weed. By the original name is marijuana or cannabis.
Okay. Cannabis.
So the weed only commonly used in Obuasi or in other part of the world or in other part of the community.
Okay.
So marijuana, and then before you go from marijuana, the latest one is the red.
Yeah.
Red. Red. See, I'm not the latest one. Obia pese okofa. So red, you say a medication that is being prescribed in a hospital facility.
Okay.
For example, the doctor prescribed it for a purpose. For example, for pain that you are going through, it's a painkiller.
Oh, okay. So the red is for painkiller.
It's a painkiller that the tramadol is a tramadol that they abuse, but they have branded it to be what? Red.
Red, okay.
It's a brand name that have changed. And now they have a dosage that you can take for maybe a particular day. That is 150.
Okay.
That is depending on severity on your condition. The doctor naturally so would you able to know back. But there is no more of far when at the acquired because it gives them some kind of excitement.
Yeah.
So those days abuse at a go. So someone will mix will take this tramadol which is 50 milligram. Okay. That's supposed to take once. Or in a day you can take 150. But almost fan is there. I call it 225. Now that's another 225. So the dosage is 25 milligram. It's more than the one you can take in a day. Because of the desired effect that they want to gain from it. And it's almost time this red that in the hospital we call it tramadol.
Okay. I say yeah, just share videos be brave. Nah. No be or da. Yeah. I don't know what causes that action.
So for the tramadol, when you take it into the system, it goes to the brain. As I earlier on talked about, it's a painkiller. So the side effect, it gives you that kind of dizziness, dizziness and drowsiness, and then sometimes it's very addictive. Okay. So when you say something addictive, meaning the brain, it becomes you want it, even despite its effect, the harmful effect, you still want it. So when the individual take the tramadol, it goes to the brain system and release that chemical. So that chemical dopamine that we call the excitement, it also come in a large quantity. So for that matter, the individual will be gathering that kind of euphoria. You call it euphoria, excessive happiness. Okay. Those say like he's feeling within himself excitement, but he's feeling dizzy because of the side effect of that medication. The dizziness will come. Because of the side effect of that particular medication. And it's not amount for
that is very dangerous.
Dangerous. Dangerous.
And see, I know it's me my dream. What about the mental health of it?
So with this, that will lead to the mental issue, mental health problem. So someone who continue to take it for a very long time, maybe once a while, the person can develop mental illness. Okay, the mental illness that will come in, the person will start hearing voices. Okay. Because of you have abused, you have overtaken it. Okay. So it will give the individual that kind of condition, that is depression and all those things. And I wanted to say something. Why do people take tramadol and all those substances? Okay. Some people have something we call boredomness.
Boredomness. Boredomness. Okay.
Yes. And depression.
Depression.
So he's going through some kind of trauma. That trauma, unless
and calming down.
Exactly.
Okay.
Exactly.
Okay. So be free more. Or calming down.
Exactly.
Okay.
So now I hear something because I get depressed. And I be so far we're anxious. Before you be anxiety. Like I am Shishe, thank you. That's the word I am Shishe. So because of that, person of father will be no bet be dinner akasa. So if I do now I hear okay and bet me sharing bet me akasa. Now because the more you take it, the more you're able to do something.
The more you become addicted
to it. So all those things is one of the major cause of it. Okay. That's why people abuse this substance abuse that we're talking about.
Okay, thank you so much. Now, Mama, last one back home to Mansania week. You know, be over Sekofe Juma Yentino, Obi to me, Juma Den Yankasa, especially your mom. In fact, Juma be a Juma Den. Obi over day be or Bedebi or Benum paracetamol, or Benum painkiller, and you may be a Benum painkiller and son of Kakoda, and so no. drug abuse now.
Yes, you are abusing that particular painkiller.
Okay.
Because for all you know, the doctor prescribed it. Doctor had trauma also condom. But only no pains no qua. And you should say to assume.
Okay.
Obi oha we no pains na ko. No asa akoto because they now don't say pains na banana asa akoto. There be yenye sa.
Okay.
Unless also doctor no ho. No that's okay. The pains no sa about. The pains no sa about there. Then doctor no okay. Pains will be a different issue.
Okay.
So I wish I will get you a different lab test so that I know the different level of medication I can give to you. So by when come to 90 at a drugstore and a pharmacy because doctor actually now no one know why you the first one, the second one not akotwa. I mean the who uses you are abusing that particular medication for unnecessary.
Okay, Mr. Wisdom.
Yes.
And we will come back right now. Ebusiya medasi se ogusa will share the health page media on Ines Pilot TV so. And you know about boy as snedom and I say boy a treat drum then a Fortune medical supplies. About medical apparatus, papa, about syringe tubes, NG tubes, VP machines, hair nets, and yama hodwa, a boa emma apomodin ejumani jinasono, a Fortune medical supplies as here and I will be at all. And into Chakwan, a Boaseramia extension, Sansona Accra. Kaswa Iron City your ho open the do to our offering it was 0542 224610. Ebusia yengina we so ni yenjebre ye ba ye to aso. Ebusia medasi bi esanso mo kwaba so oguso hwe the health page media on Ines Pilot TV so and a substance abuse me say unim red no and ya kata alpha red bi o ha fa ngozi baby ya o red bi o ha baby e dey copy na psychiatric hospital and as obegina kwa ho no ada o to kwa no ya sure sum pain obedwen ho a won ti ase eno na ya kasa fa on ye Mr. Wisdom ana etoche enkomo enti ye to aye enkomo nso. How about you?
That's it. Yeah. So thank you for that. I would like to use this opportunity again to thank my audience for listening to us. And I hope they are paying attention to this serious issue. So thank you for this platform again.
You're welcome. Okay, let's continue with what we are saying. So how, what are some of the symptoms?
Okay, the symptoms of substance abuse are a dorsal.
Okay.
But Yebeka kakrebi.
All right.
So because of so for you to see someone who abuses substance first, we obia utai ejumadin. Ana utai ko ejuma, oko ejuma ba say ejuma ko no asisa.
Okay.
Sometimes do obi say obi o house a onum drone and some abejuma so that obetumi abo ejuma ni yiye. But edu baby a ejuma be we obo ejuma no asisa. So obi say baby o fa lawyer, the friend say lawyer. O the lawyer na kan ho ansa na ejuma di no obetumi aye ni yiye. So be on fa lawyer na obi say no ejuma no about form. Then sometimes obi say no aye social withdrawal as we already talk about that.
Yeah.
Because on person will be able to say
no so pampan pa we den will be able to say
exactly.
Exactly. Tebasa no ntumi kan ho nko
that was true. Obi o no fair to because ebasa o fair say we come how do say as say will be abusing drugs.
Yeah.
So and then some people their lifestyle also changes.
Yeah, okay.
The way ni subanti or feel no na asisa, ni kasa ni na asisa, obafia na odi di atem. One of the substances that I've not even captured earlier is alcohol.
Okay.
Obi o ha, o say if person be can adwin actually obi. No alcohol. No alcohol and say na obetima gina ni na so. So it will bring what some kind of conflicts.
Yeah.
So when the pakon no dey bia into kwa But dear into kwa ebafie.
Maybe I high.
Because of offense, one no insa, no one jot, one no cigarette, one no we account.
Yeah.
No, I feel high, so I feel I can argue always no edin to kwa ebeba. Na obi a say papa we. She said was say oh who say now who say there will be baby okoso. Either say he's abuse and drugs that is affecting him.
Yeah.
But he's not able to voice it out. And I do so.
Okay.
That is, we call it insomnia. So it became the drug has become part of him. So with that particular medication, a day on to mean that. Unless offer that particular medication as an obey to me. Like last time I met one young guy, no abusing drugs no. And this one say, how a common not startify way. Also, madam for being a dad and they say, oh, far we are, no water. Now, some people sleep a lot when they are abusing the drugs. Yeah. That's what I wanted to come in. Almost that because of far drone, a man or double brain. So, double brain, you have to increase that quantity of medication and so on. And look what a sign. So, you are abusing the drugs.
Okay.
So, you have to withdraw yourself out of it. The more you continue to eat with it, the more you become a damage to your health. And then obiso oha, obi so mitinu, no jaino. And then rasta bia na no but you find is that obi won say your brain take come but everybody you started find normal way. The lifestyle of asisa, especially the dressing code, normal being na asisa. And na down for so friendship relationship na asisa. We don't want to say when maybe girlfriend relationship sometimes we go kwa kitu we ko fa we only we na end to me. So sometimes we were a girlfriend and now we bad a bemadi. No the first one is any stand or tie. You have to ask whether you have been taking any lawyer. We call it lawyer. But it's a substance. Whether you have taken any drugs that have been affecting him nowadays. So you see that the person's behavior, communication to you have changed.
Yeah.
Kasa na enko yi obi betimi akasa say oh say but only dey na oka. Obi say dey na oka na say because na efi. That will become the memory problem, forgetfulness. Some of them will have forgetfulness and they will never be able to remember whatever they have thought of or whatever they have done previously. And you know obi no nsa obua obi say oh sorry, we have to know so business dey say oh me dey see.
But obi nso tumi no monsa na shankom.
Shankom.
Yeah. I know of someone Obua or shankom.
But I say I come in this come here.
Okay. Because
okay.
He's in my area.
Exactly. Okay.
Na onum no aye higher. Come so be show no. No, I should maybe. I'm a bem. Yes, I should maybe I'm a bem. And I was like, wow.
Okay.
And
so because something the individual have a memory level or conscious, we call it your consciousness. So you have level of consciousness, and some of these drugs, a bit may affect your level of consciousness.
Okay.
So your no matter true. And now you can send the secret betrayal. That secret, about some your pre-conscious level.
Okay.
So you don't want to catch your beer. But because of fans are a bit trigger, so all these things will come out. No, I catch you. Only time we say, then they will go to those who take in alcohol because at that time. Their pre-conscious level, everything come out from their conscious level. So when you say, "Oh, you come," but you come.
Okay.
Because of what is being stored in your pre-conscious level. At that time, because of that drug, that lawyer, I got trigger. Send the brain. Then a chunk. I tell you better.
Yeah. Okay. So go for our time. Obesanso aba na yasanso treaty and as yasanso be more. Let's try and make it short. Yeah. And see how can we avoid it? So from then we go to the treatment?
Okay. For one thing I would tell my audience or anybody hearing us right now is that when you are into this, it's possible to avoid it.
Okay.
Because one, you know how you started it.
Yeah.
Sometimes maybe friends been introduce you into it. So to make this short, you have to take yourself out of it. Or you are down for a check.
Okay.
You are trying to avoid the way of abusing it because your friend and you. So when you avoid, you take yourself out of that kind of toxic relationship or friendship. You are rather avoid. You are making yourself safe, and you are avoiding that kind of substance abuse. And at the end of the day, you will be able to treat yourself very well. And also sometimes curiosity, the person
yeah.
So sometimes not everything that you have to even taste. Bible can say we have given everybody all the opportunity, but it's not everything that is good for everybody. So one can say so to avoid, you have to get the limit. Maybe this person is the cause of it. This and this, my problem. The person is make a change. That was my problem. And you don't let me aka. And so let me have boss. So one you free. So one problem not what down to be no bet me a trusting a problem. That's all about me. About to also be abusing.
Treatment. Now, how can you treat it? Okay, you said some. So how can we treat it?
Okay, so we said substance abuse is treatable.
Okay.
Sometimes when it comes to substance abuse, it's treatable. But before you get me a treatment, your psychological treatment and your medical treatment.
Okay.
So you got medical treatment, and it should say the deep complication, that is mental problem, the how be account. One, you started having hearing of voices.
Yeah.
And you are not able to sleep. And then you started telling people that you are the owner of this hospital, you are the owner of the world, or Boise government hospital, or AG, you are the owner. All these things are mental signs and symptoms of mental illness.
No. Okay.
So when I do medical treatment, so a bit me I and you are free home, and the way we are aggressive. We are aggressive. I know the medical treatment by my word. So the way to me down, bet me a boss, bet me a that. Now I'm a dream about me a that. And the way to Casadio or Suma, and then you will do a bet me a diamond. I bet me a in Africa that we call hallucination. So a bet me that hallucination. Africa and I be a kind of brand delusion in my word, so a baby in Africa. So then the second one, that is the psychological management or treatment.
Okay.
This one I'm going to make it short. The psychological treatment we have to go into psychotherapy.
Okay.
Under the psychotherapy, you have something we call cognitive behavioral therapy. And you want to say be over. I need the kappa say. Kappa say my cat terms no above. Over there. So you and so idea of you don't modify behavior.
Okay.
Obi over yeah, I mean a counseling. So behavioral therapy now you can say it will involve with what counseling.
Okay.
Before you be counseling one kasa also.
Yeah.
Are you ready to stop? That's the first question. Your readiness. Give us 80% chance of you surviving it.
Surviving.
You get it?
Yeah.
So obi bahono when you're ready to obi chaya into me helping.
Okay.
Your own is that just 20% that we will give you, but 80% of readiness of taking this problem away lies on that's a psychological aspect. So you have to be psychologically prepared that I'm ready to stop this thing because warn me. And then the third one is your willingness to cooperate with the counselor,
okay,
or the health practitioner.
Yeah.
So we there, they know better to me the bet me I my uni afri. And sometimes your center, your friend rehabilitation center.
Okay.
The paco bet me alcohol for maybe 6 months or maximum 6 months for vigorous training. Why do you give this people to go for that area because environment so can what change your environment one so for that one counseling, psychotherapy, and your readiness.
Okay.
Me, I always say your readiness is number one.
Yeah.
If you are not ready, we can't help you.
Can't help. Yeah.
Obi wa yema no do kono sa coffee no sa no. So o mama na edru. So o mama na edru there ni hunton there bi. Yema wo do say the same thing no nya no betimi afio but the psychological management no enu agina wo ho.
Okay.
So obetimi agina say no we edium. And your step, your guidance step that we can give to you that who are abusing alcohol person jaya. Your step be able to me actually said this step will be this step so I bet me about over this step I bet me about but to me engine once so ne was
na just say in fact substance abuse na nkata na was say you shed that per time na you're treating them more your time no I break and until no ebusian che ye di adwumedie no ebekwa wie Mr. Wisdom Mr. Ebedawase so what are your final words we are not be watch ya adofo na ye di adwumedie
so what I would tell my lovely youth out there say substance abuse or drug abuse is very dangerous to our health. And why obi odachi because of substance nti the dash in asay the power chow obi catch you say file lawyer na obi o do some youths be who say you have to take some kind of drug before you can perform or before you can be a man. Please, if anyone you have a friend who tell you take this before you can be a man, tell the person it's better to be a woman than to be a someone who is sick, who have a liver problem, who have a kidney problem, who have a mental problem. At the end of the day, your mindset that you are trying to show is cost 90.
Yeah.
So a better say to be a woman, because you man, meaning someone it's better to be a woman than to be a man that will cause a damage to you. So I'll use this opportunity to also extend my greeting to my lovely people out there, especially the people of EP Church, Akaporeso, my catechist, Mr. Agbesi, Mauli Agbesi, and CEO of Mauli Hotel.
Okay.
Presbyter Kagoche, I greet you. And then the staff of Obuasi Government Hospital, especially my in charge, the deputy in charge, Sister Gina and Sister Monica. Okay. Thank you for all your support. I think they are the team that can make a mental health very vibrant in Obuasi. I greet all of you. Okay. Thank you to Nina for giving us this great opportunity. I think this is a great thing. The community have to support you to make it go far and beyond, not only in Obuasi, it should go international so that we can go far and make mental health a great asset to the nation so that we can save life. Thank you.
Thank you so much, Sue, for coming. I believe when we call you once again, you'll come back and then educate us. We really appreciate it a lot. Everything I had near the age no ABC. I'm fast like I say, and from our algebra na o share a bedroom purpose way. Edi no I Empress Nina. Nyako panya aduma dasene yebesansu Asia Macau.